so now what we want to do is learn how to side each of these bones in the lower leg. So, the femur is the easiest. Head always has to point towards the medial side, and we know it's anterior if we can see the articular surface of the patella, or we know it's posterior if we can see the intercondylar fossa. So with that, we know that this one is a left. The tibia, we know, is always going to be on the medial side of the lower leg. This is called the medial malleolus, so that tells us that this is on the medial side. This has to be lateral, and the tibial tuberosity always points anterior, which means this also has to be a left. And the hardest of the three is our friend, the fibula here. The head is on the proximal side, the lateral malleolus. The more smooth side is always going to point towards the outside or lateral. And then anteriorly facing with the tibia, you're going to have a very sharp ridge here. And this is created because these two bones are tethered together by a type of joint called a syndesmoides, specifically a type of that called an interosseous membrane, that basically it's like a big ligament that holds these together. And that creates tension on it to make it look sharp. So this sharp ridge will always point anteriorly. So sharp ridge up, lateral malleolus down, and pointed, smooth side pointed laterally. So this one also has to be a left.